Skin tags. Skin tags are also known as soft fibromas, acrocodons, or fibroepithelial polyps. Skin tags are benign, pedunculated, or sessile papillomatous growth of skin mainly composed of epidermal and stromal components. Skin tags present as multiple flesh colored papules or filiform lesions or solitary pedunculated papules. The size varies from 1 to 5 millimeter. The most common sites are neck, axilla, groin, and other intertriginous areas. Usually they are asymptomatic, but sometimes may be associated with symptoms of itching, irritation, and pain due to rubbing against the clothes. They also can become secondarily infected. They can also twist on their pedicle and undergo infarction. The etiology of skin tags are not well understood. They're thought to arise because of frictional rubbing between skin surfaces as they're found in the intertriginous areas. The certain associations of skin tags are diabetes mellitus, obesity, cardiovascular diseases, abnormal lipid profile, colonic papules, insulin resistance, and acromegaly. They're increasingly found in patients with diabetes and dyslipidemia, and patients have to be evaluated for the same. Histopathology of skin tags. It consists of a fibrovascular core, sometimes along with fat cells, covered by an unremarkable epidermis or by an acanthotic flattened epithelium. Differential diagnosis of skin tags are fibrokeratoma, accessory tragus, pedunculated seborrheic keratosis, pleomorphic fibroma, polypoidal intradermal melanocytic nevus. Treatment options include cryotherapy or surgical excision.